All right, happy Monday, everybody. Happening now in America's newsroom.
The man behind the message, Adam Gadon, otherwise known as the American Al-Qaeda. We know Al-Qaeda's story, but how does a kid from California end up working hand in hand with bin Laden?
Also, we are heading into the most dangerous part of hurricane season. It is mid-August soon, and Janice Dean has some new predictions for the next couple of weeks on America's newsroom. We'll get to that in a moment.
Well, some new details today on a medical procedure being billed as the new and improved liposuction. They call it SmartLipo, a procedure that is supposed to melt away fat and tighten up the skin with little to no pain. It is so fast and easy, doctors say patients can go to work the very next day, unlike regular lipo, which requires days to weeks of recovery. What's the deal? Is this for real? Or is this yet another scam? Dr. Jennifer Walden is a plastic surgeon, and we ask her now, okay, so they call this SmartLipo, and unlike regular old lipo, which, you know, has that tube that we've all seen that video of them jamming it into people's thighs and sucking out the fat, this operates by laser?
Well, actually, there are several new trendy methods that are touting dissolving fat. One would involve sticking a laser underneath the skin and then suctioning out the fat. And that's something that is somewhat similar to our standard liposuction because the laser is helping to melt the fat, but then we're suctioning it away. The other one that is cropping up and paramedical professionals are doing it, doctors and nurses aren't even supervising, is injecting dissolving materials under the skin and allowing the fat to be melted away and then excreted, and that's truly unsafe and has not been proven to be effective yet, and isn't approved by the FDA.
Whoa! So basically, that's just like you get an injection and then it's between you and your bathroom, and
right.
The fat's gone.
Right, exactly, and that's become more and more common these days. And we really, plastic surgeons and the plastic surgery societies are really warning against it because the only safe and proven effective way to remove fat cells permanently is standard liposuction.
Okay, but this so-called SmartLipo is with a laser, and that melts the fat, and then they suck it out. And this is supposed to. The amazing thing people say about this is that it's supposed to actually tighten your skin. So if you get it done on your stomach, you don't leave with like all this fat gone and rolls of skin left. Your skin is actually supposed to tighten up. That's unusual.
Right. Well, I think that these things should be taken with caution because part of traditional liposuction or ultrasonic liposuction is that the skin retracts after the fat is taken away. That's part of the inflammation process created by the cannula. And now we just are developing better lasers and better methods to make that fat kind of melt away or make the cell membranes disrupt. Then we suction it away, but the same inflammatory process is going on, causing skin retraction. So I think the point here is just to research the procedure, make sure it's FDA approved, go to a board-certified plastic surgeon or dermatologist, and someone that has a lot of
You got to go to a respected professional. Let me ask you this too. I have heard reports that when you get this SmartLipo and you get the fat sucked out of your arm or wherever, a secondary effect can be your breasts get bigger. Is this true?
If that's the case, then I'm going to have a line of people out of my office wanting to do that procedure. But no, that's not true.
Okay, don't believe everything you read,
right,
I guess.
Exactly. Sounds good.
Okay, so interesting. Dr. Jennifer Walden, thank you so much.
Thank you.
What are you doing for lunch?